Imagine you're working with a client who engages in persistent hand flapping. Is that behavior maintained by the sensory feedback it produces or by the attention it gets from others? That's the core distinction between automatic and socially mediated contingencies, and understanding it is essential for designing effective interventions. In this video, we'll break down what these two types of contingencies are, compare them side by side, and explore the 4 specific contingency types you'll need to know for the BCBA exam. We'll also cover key differences, how to identify automatic contingencies in real-world practice, and the assessment methods that help you pinpoint the maintaining variables. This topic directly supports tasks in domains B and F of the 6th edition TCO, so mastering it will sharpen your conceptual understanding and your ability to conduct functional assessments, both critical for exam success and ethical practice. On this slide, we're drawing a critical distinction between automatic and socially mediated contingencies, a concept you'll see tested on the BCBA exam in both definition and application. Automatic reinforcement occurs when the behavior itself produces the reinforcing consequence, like scratching an itch or humming for sensory pleasure, with no other person involved. Socially mediated reinforcement, by contrast, requires another person to deliver the consequence, such as a teacher giving praise after a correct answer. The same logic applies to punishment. Automatic punishment happens when the behavior directly produces an aversive outcome, like touching a hot stove, while socially mediated punishment involves someone else delivering the consequence, like a reprimand. The key exam point is identifying whether the consequence is produced by the behavior itself or by another individual. On the exam, you'll need to recognize these distinctions in scenarios. For instance, determining if a client's behavior is maintained by automatic sensory feedback versus attention from others. Mastering this helps you design function-based interventions. On this slide, we're comparing automatic and socially mediated contingencies, a key distinction for the BCBA exam because it affects how we analyze and intervene on behavior. With automatic reinforcement, the behavior itself produces the reinforcer without another person's involvement. Hand flapping that provides sensory stimulation is a classic example. This makes the reinforcer inherent to the behavior, often seen in self-stimulatory actions, and it can be difficult to control because you can't simply remove a social mediator. In contrast, socially mediated reinforcement requires another person to deliver the reinforcer, like a teacher praising a student for raising a hand. This is common in instructional settings and is easier to manipulate by changing the mediator's behavior. Similarly, automatic punishment occurs when behavior produces its own punisher, such as touching a hot stove causing pain, leading to avoidance. On the exam, you'll need to identify these contingencies and scenarios and choose interventions accordingly. For automatic contingencies, you might use sensory replacement or environmental enrichment, while socially mediated ones allow for modifying the mediator's actions. On this slide, we're breaking down contingencies into 4 critical types that you must be able to distinguish for the BCBA exam. Automatic reinforcement occurs when the behavior itself produces the reinforcing consequence directly, like scratching an itch, where the relief reinforces future scratching without anyone else involved. Socially mediated reinforcement, by contrast, requires another person to deliver the reinforcer, such as a parent giving a cookie after a child says please. Similarly, automatic punishment happens when the behavior directly produces its own punishing consequence. Running into a wall causes pain, which decreases that behavior. Socially mediated punishment involves another person delivering the punisher, like a teacher issuing a timeout after a student talks out of turn. On the exam, you'll often see scenarios testing whether a consequence is automatic or socially mediated, so focus on whether the environment directly changes or another person is the mediator. This distinction is foundational for designing effective behavior change interventions. On this slide, we're drawing a critical distinction between automatic and socially mediated contingencies, a concept you'll need to master for the BCBA exam. In automatic contingencies, the consequence is delivered directly by the behavior itself, with no other person involved. Scratching an itch provides immediate relief automatically, and touching a hot stove causes pain directly. In socially mediated contingencies, another person must deliver the consequence, like a parent giving candy for saying please, or a teacher assigning detention for talking. This difference matters for assessment and intervention. Automatic contingencies are harder for practitioners to control because the reinforcer or punisher is inherent to the behavior, often seen in self-stimulatory or sensory-maintained behavior. Socially mediated contingencies are easier to manipulate because you can change how others respond. On the exam, you'll need to identify which type is operating and choose the appropriate intervention strategy. On this slide, we're zeroing in on how to identify automatic contingencies in practice, a key skill for the BCBA exam. In a functional analysis, automatic reinforcement is tested in the alone condition, where no social consequences are available. If the behavior persists here, it strongly suggests the reinforcer is internal, like sensory stimulation. Behaviors maintained this way, such as hand flapping, rocking, or repetitive vocalizations, often occur at high rates regardless of social context because the reinforcement is always available. For the exam, remember that these behaviors can be tricky to treat. Interventions typically involve providing alternative sensory stimulation or blocking the behavior, rather than manipulating social consequences. A critical assessment indicator is that if the behavior continues in the alone condition, you're likely dealing with automatic reinforcement. This understanding helps you design effective, function-based interventions, a core competency tested on the exam. When you're assessing behavior on the BCBA exam, the first clue to distinguishing automatic from socially mediated contingencies lies in the functional analysis conditions. In the alone condition, if the behavior persists, like hand flapping or rocking, it suggests automatic reinforcement. The behavior itself produces the sensory consequence, independent of others. Conversely, if behavior is elevated only in specific social conditions, attention, escape, or tangible, you know it's socially mediated, meaning another person's actions are part of the contingency. This distinction directly shapes your intervention focus. For automatic functions, you provide alternative sensory stimulation or block the behavior. For social functions, you modify consequences using extinction or DRA. On the exam, expect questions asking you to interpret FA data patterns. For instance, behavior that remains high across all conditions, including alone, points to automatic reinforcement, while behavior spiking only in the attention condition signals a social function. Mastering this assessment logic is critical for designing function-based interventions. When you're analyzing a behavior on the BCBA exam, the first step is to observe the target behavior and its immediate consequences in the natural environment. This is where functional assessment begins. Next, you determine the source of the consequence. Ask yourself whether the consequence is produced directly by the behavior itself, like the sensory stimulation from hand flapping, or delivered by another person, such as a teacher providing attention after a tantrum. This distinction is critical because it leads you to classify the contingency as either automatic or socially mediated. Once classified, you select an intervention that matches the contingency type. For automatic contingencies, you would use sensory-based alternatives or non-contingent access to competing stimuli. For socially mediated ones, you would modify social consequences, such as extinction or differential reinforcement. On the exam, recognizing this classification process helps you choose the most effective, function-based intervention, a key skill for questions on behavior assessment and treatment planning. Let's now examine automatic contingencies, where the consequence is produced directly by the behavior itself, independent of another person. On this slide, you see examples of automatic reinforcement, like scratching an itch to relieve a sensation or listening to music for auditory pleasure. These behaviors are maintained by the sensory consequence they generate. Similarly, automatic punishment occurs when the behavior's direct effect is aversive, such as touching a hot stove causing pain or eating spoiled food, leading to nausea. For the BCBA exam, recognize that automatic contingencies are clinically significant, especially in autism spectrum disorder, because the reinforcer is inherent to the behavior, making it difficult to interrupt or replace. Interventions often involve sensory integration strategies, blocking the response, or teaching a functionally equivalent replacement behavior that produces a similar sensory outcome. Understanding this distinction from socially mediated contingencies is critical for designing effective behavior intervention plans. On this slide, we're breaking down socially mediated contingencies, where another person delivers the consequence, into 4 key examples you'll need to recognize for the BCBA exam. First, socially mediated reinforcement. A child says please, and a parent gives a cookie, which increases polite requests. This is a clear instance of positive reinforcement delivered by another person. Next, socially mediated punishment. A student talks out of turn and receives a teacher reprimand, decreasing that behavior. For attention-maintained behavior, a child tantrums and a caregiver provides attention, strengthening future tantrums in similar settings. Finally, escape-maintained behavior. A student aggresses and is removed from a task, increasing aggression to escape demands. Notice that in each case, the behavior's future frequency depends on a social mediator, another person's action. On the exam, you may be asked to identify whether a contingency is automatic or socially mediated, or to select which type of social contingency is operating based on the consequence delivered. On the BCBA exam, you must distinguish automatic from socially mediated contingencies, as this directly impacts functional analysis, interpretation, and intervention design. An automatic contingency means the behavior itself produces the consequence, like scratching to relieve an itch, so no other person is required. In contrast, socially mediated contingencies depend on another person delivering the consequence, such as a child whining to gain a parent's attention. During functional analysis, automatic reinforcement is suspected when behavior occurs at high, stable rates in the alone condition, because no social interaction is needed. Socially mediated behavior, however, appears only in specific social conditions, like escape from demands or access to attention. This distinction guides your intervention. For automatic functions, modify the sensory environment, like providing alternative stimulation. For socially mediated functions, modify social contingencies, like teaching communication or adjusting reinforcement schedules. Recognizing these data patterns, stable versus variable rates across conditions, is essential for accurate functional assessment and effective behavior change plans on the exam. When designing interventions, BCBAs must distinguish between automatic and socially mediated contingencies because the approach to extinction and reinforcement differs fundamentally. For automatically maintained behavior, extinction is difficult since the reinforcer is inherent to the behavior itself. You cannot simply remove the sensory consequence. Instead, the primary strategy involves providing alternative sensory stimulation, such as a vibrating pillow for sensory input, or enriching the environment with competing sensory options. Differential reinforcement here pairs DRA with alternative sensory activities that match the function. In contrast, for socially mediated behavior, extinction is easier because you can withhold the social consequence, like using planned ignoring for attention-maintained behavior. Here, DRA uses social reinforcers, such as delivering attention for appropriate requests. On the BCBA exam, expect questions that ask you to select the correct intervention based on whether the maintaining variable is automatic or social. Matching the strategy to the contingency is key. To succeed on the BCBA exam, you need to master the distinction between automatic and socially mediated contingencies by focusing on who or what delivers the consequence. Memorize the core definitions. In an automatic contingency, the consequence is a direct, inherent product of the behavior itself, like the sensory stimulation from hand flapping, while in a socially mediated contingency, another person must deliver the consequence, such as a teacher providing attention. When analyzing functional analysis conditions, remember that the alone condition specifically tests for automatic reinforcement, whereas attention, escape, and tangible conditions all test socially mediated contingencies. A quick way to identify the mediator is to ask, if a person delivers the consequence, it is socially mediated. If not, it is automatic. Practice with vignettes by reading scenarios and classifying the contingency type before looking at answer choices. This builds fluency. Finally, connect this to intervention. For automatic reinforcement, use sensory alternatives. For socially mediated, modify the social consequences delivered by others. As you close out this topic, remember that the core distinction between automatic and socially mediated contingencies hinges on whether the consequence is delivered by another person or is a direct, inherent product of the behavior itself. You've explored how automatic reinforcement, like the sensory relief of scratching an itch, can maintain behavior without any social interaction, while socially mediated contingencies, such as a teacher's praise, depend entirely on another individual's response. On the exam, you'll need to identify which type is at play by analyzing whether the behavior persists in the absence of others or changes when social consequences are manipulated. Master this distinction because it directly guides your intervention. Automatic contingencies often call for sensory-based replacements or environmental enrichment, while socially mediated ones require adjustments to the social environment, like extinction or differential reinforcement. You've built a strong foundation here. Now, take that clarity into your study sessions and practice applying it to real scenarios. You've got this, and every concept you master brings you one step closer to that BCBA credential.